Hi everyone, the following is my presentation regarding whether or not patients should have access to their electronic health records. My thesis statement is that yes, patients should have real-time access to electronic health records, including physician notes and real-time access to test results. The following slides will go over why I feel that patients should have full access to their electronic health records. The Institute of Medicine identified 6 different domains that should be focused on to improve the quality of care that patients receive. The 6 different domains are patient-centered, effectiveness, timeliness, efficiency, safety, and equity. Electronic health records contribute to all of these domains, but I thought that the domain that stood out the most was patient-centered care. Patient-centered care is based on the provision of services that respect and respond to individual patient needs and preferences. Open communication through electronic health records allows a physician to be respectful of and responsive to individual patient preferences, needs, values, and ensure that patient values guide all clinical decisions. Access to electronic health records allow patients to become key stakeholders in self-management of their healthcare and disease management. Patients are at the center of the decisions that are made, what they're comfortable with, what they want to get out of the relationship with their provider, and they're also educated to be able to make decisions regarding what type of care that they want to receive. One of the strongest reasons for patients to have full access to their electronic health records is the ease of communication with providers. Electronic health records enhance patient communication and outcomes through electronic messaging, scheduling reminders, access to laboratory and test results that are up to date, the tracking of progress over time, and educational resources. Studies have shown that patients feel more comfortable in office visits after communicating with providers previously. Patients are able to communicate via email, text, and telemedicine that provides video abilities. Patients communicate directly with their physician or share records with other physicians, easing the transition between different care providers. There's also appointment reminders and the ability to cancel scheduled appointments, and patients are able to input data manually or via medical devices such as Fitbits, glucose monitors, and devices that measure vital signs. Studies have shown that 90% of U.S. consumers with internet access prefer online communications with healthcare providers rather than inpatient visits and telephone phone calls. One study by Kaiser Permanente looked into the impact of electronic patient-physician messaging. KP Health Connect is an integrated electronic health record service for all members of Kaiser Permanente healthcare delivery system. All messaging takes place in an authenticated, encrypted web environment behind an enterprise-level firewall that is safe and secure for patients. Among 1,000 registered users, 70% of sessions resulted in patient-physician messaging. Through the study, they found that annual primary care visits remained the same, but visits in the post-period were significantly reduced. The study felt that the ability for patients and providers to connect and message over time reduced the need for patients to come into the office. Of all the messages, 19.4% of messaging threads showed that the physician recommended further care such as laboratory tests, phone calls, office visits, procedures, or health education. The study showed that patients received electronic messaging as preferable to telephone consultations, and users reported that they were satisfied with the option of electronic messaging in lieu of scheduling an in-office appointment. Another reason for patients to have full access to their electronic health records is efficiency and safety. With full access, patients can ensure that their records are correct and up to date. They can ensure that prescriptions can be filled electronically and sent to the pharmacy of their choice, and that there is no medication errors or dosing errors. This also eliminates the need for duplicate tests, and patients are able to share their records between multiple providers without delaying care or a loss of information. Another reason why patients should have full access to their healthcare records is the ability to engage in their healthcare plan, preventative care, and disease management. One way that patients are able to engage in their care is by uploading data about their health status through monitors such as vital signs, glucose checks, Fitbit information. All of this information can be uploaded and then tracked over time so that patients can see where they are and communicate with their physician on what they can do to better coordinate their care, any lab tests they need done, any education materials that they should be looking into. Full access to the electronic healthcare records allows patients to be an active member in their healthcare plan and allows them to really explain what their preferences are, what they want out of their healthcare, and what they can do to really implement the plan that's been put before them. Having access to electronic healthcare records is really important for patients with chronic conditions. The American population is aging with an increase in chronic conditions such as heart disease, asthma, and diabetes. Chronic conditions have been found to be the leading cause of disability, illness, and death in the United States. Today, 29 million Americans have type 2 diabetes, and 86 million Americans are considered pre-diabetic. Management of chronic conditions have been found to be successful with self-management by the patient. Self-management is more successful when patients have a strong support system, collaboration with clinicians, individualized plan of care, and continued education. Full access to electronic healthcare records provides all these areas of support to patients with chronic conditions, especially patients with diabetes. Using electronic healthcare records, these patients are able to communicate with all different physicians from different specialties, link all of their records to all these providers, come up with an individualized plan of care, and continued education about glucose control, meal preparation, wound care, and how they can manage their disease at home without having to travel to appointments and leading to hospitalizations, which reduce costs. This is really important today with so many people suffering from chronic conditions, and it's been found that 40% of these individuals suffer from multiple chronic conditions at a time. Another benefit of patient access to electronic healthcare records is a reduction in healthcare costs. Access has led to reduced spending on physician office appointments and laboratory services. There's lower costs associated with disease management, especially for chronic conditions, and a decreased length in stay in hospital admissions. It's been found that an overall reduction in office visits would allow time for additional patients with a higher level of service to be seen, or even preventative care appointments to be completed. One concern over allowing patients to have full access to their healthcare records is whether or not the records are secure and whether messaging would also be secure. There have been several laws put into effect to ensure this security. The HITECH Act was put in place in 2009 and is called the Health Information Technology for Economic and Clinical Health Act. The act was designed to encourage healthcare providers to use electronic health records and achieve meaningful use of electronic healthcare records so that they could be financially supported. In order to obtain financial incentives, healthcare providers must perform specific tasks that demonstrate the provider is meaningfully using a certified electronic health record. Another law that was developed to help protect patient security and information was the Health Insurance Portability and Accountability Act, or HIPAA. It was first implemented in 1996 and required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. In 2013, the security rule was added to this act and required administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of electronic protected health information. In conclusion, it's my opinion that patients should have full, real-time access to all of their electronic healthcare records, including test results and laboratory results. Full access promotes patient-centered, safe, efficient, and timely care. It encourages patient education and utilization of health resources, placing a patient as a key stakeholder in the management of their care. Full access also reduces healthcare costs and prevents unnecessary office visits or waste of resources. Thank you so much for listening to my presentation. Thank you.